I'm Amanda McCormick. I'm from Crim, and I'm going to be talking about medical forensic exams, which are conducted by forensic nurse examiners after someone has experienced violence. Medical forensic exams are largely healthcare driven, for example, checking for and treating injuries from a sexual assault. However, patients can also request a forensic exam where evidence can be collected for use in a criminal case should the patient choose to report to the police. And research does suggest that forensic evidence improves legal outcomes for survivors of violence. So we conducted an online survey with people who've experienced either intimate partner violence or sexual violence in British Columbia, and we asked about their access to medical forensic exams. What we found are participants reporting extremely high rates of violence. Over half of those who experienced intimate partner violence and a third of those who experienced sexual violence had reported being strangled. Strangulation is a high-risk behavior with the potential to cause brain injury, cardiac arrest, stroke, and even death. Strangulation involves pressure being placed on the neck, impacting airflow and blood circulation. Even just a little bit of pressure, less than it takes to open a can of pop, is enough to prevent oxygen from traveling to the brain. Access to medical forensic exams are therefore potentially life-saving options, especially because physicians don't tend to have specialized training in strangulation, whereas forensic nurses do. But in our sample, only 10% of survivors accessed a medical forensic exam. There's many barriers to accessing these exams. In the Fraser Valley, we have 24/7 access to forensic nurses who work out of the Abbotsford and the Surrey hospitals, who will see patients who've experienced any form of violence, including intimate partner violence. But forensic nurse examiners are not consistently available throughout the province, and in many places, they're restricted to only seeing patients who've experienced sexual violence. Given the severe forms of violence that we found in our study, especially for intimate partner violence survivors, this is a huge concern. Access to medical forensic exams should be considered a best practice for survivors of violence, not only an issue of equitable access to justice, but also potentially one of life safety. Thank you.